Can upper respiratory infection turn into pneumonia? Respiratory infections may cause similar symptoms such as coughing, excess mucus, nasal congestion, a runny nose, and a sore throat. Each type of upper respiratory infection may cause characteristic symptoms as well. Doctors classify these infections based on their location in the respiratory tract. Most people recover from a upper respiratory infection within 2 weeks with or without over-the-counter or home treatments. However, if the symptoms get worse or are severe, a person should contact a doctor. Can it turn into pneumonia? According to the American Lung Association, certain bacteria and viruses responsible for upper respiratory infections can lead to pneumonia. The bacteria most often responsible for pneumonia are Streptococcus pneumoniae. Common viruses that can cause pneumonia include influenza and respiratory syncytial virus or RSV. Influenza can be fatal, particularly for people living with pre-existing conditions. Respiratory syncytial virus or RSV is the most common form of viral pneumonia, and typically it is not as serious as bacterial pneumonia. Therefore, it is beneficial for a person to receive both the influenza vaccine and the pneumonia vaccine. Doing so can decrease the risk of transmission of these conditions and reduce the severity of disease in those who get sick. Is it contagious? A upper respiratory infection is contagious. It spreads through tiny droplets that a person with an infection exhales. Individuals may contract the illness through breathing, in an uncovered cough or sneeze, or via hand-to-hand contact with unwashed hands. A person who touches their hands to their eyes, mouth or nose can introduce the virus to their system. The body has several natural defenses against upper respiratory infections. The hair lining, which traps infectious agents. The cells in the lower airways, which help transport pathogens back to the pharynx. The mucus, which traps infectious agents. The angle between the pharynx and nose, which helps prevent pathogens from falling into the airways. When to contact a doctor? While most upper respiratory infections resolve without medical attention, complications can arise, some of which can be severe. A person should receive medical guidance if they have a upper respiratory infection and their symptoms keep getting worse. They cough up blood or bloody mucus, fever that lasts more than 4 days. They are over 65. They are pregnant. They have a weakened immune system. They have any long-term health condition. Prevention. It is not always possible to prevent a upper respiratory infection, but taking the following precautions can help. Covering the mouth and nose when sneezing and coughing. Avoiding cigarette smoke. Avoiding crowded, enclosed spaces when possible. Avoiding sharing drinking glasses and utensils. Cleaning and disinfecting objects that others frequently touch, such as shared keyboards. Having a balanced diet. Washing the hands frequently. Exercising regularly. When spending time in a crowded space is unavoidable, increasing the ventilation, such as by opening a window on a packed bus, may help.